helping other people truly understand what public health means and what it is so that they can start to value public health. We bring that value by taking the effort to explain it, and then we can start to value our industry and other people start valuing our industry as well. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports nonprofit organizations that serve Black, Indigenous, and people of color communities, which are often referred to as BIPOC communities. We are often invited to support tribal organizations, and we're always humbled and truly excited and honored to serve. We help our clients collect, analyze, manage, and communicate their data and health information in plain language to the communities that they serve. If your organization serves or supports BIPOC communities, or if you are genuinely interested in building relationships with BIPOC communities, then please reach out to us. Be happy to discuss how we may be able to support you. You can reach out through our website, drchuntley.com, and we'll also have the links in the show notes for you as well. On this episode today, we are going to dive into the topic, the question, what is public health? I had intended to prepare this episode. It's been on my mind for quite a while, actually. I remember searching through, I often attend conferences, and I want to go in the rooms where the thought leaders are, and I want to know what's keeping them up at night. I want to know what other people are wrestling with. So as I hang out at conferences and I'm listening to conversations and looking at, kind of what's happening around me, I noticed this pattern for a while. A few leaders have made these comments about how we need to increase our value, like value our industry as public health. And we do that by making sure that we're leading these conversations that is explaining public health. A lot of this came into the frustration during the COVID pandemic when we saw a lot of medical professionals stepping up to the mic to answer questions that were public health questions instead of bringing the public health practitioners and experts to the microphone to answer questions. They were confused. There's a lot of confusion. And healthcare professionals are not necessarily trained in public health unless they sought that credential and had that training. We were frustrated, a lot of us, with the confusion that emerged. But we also know it's frustrating sometimes to try to explain public health because it is so broad. We want to try to explain it, but sometimes it gets confusing. Have you ever been in a situation where someone asks and, your mind is kind of racing around to kind of figure out what version are we going to, use to explain it, what examples are we going to use? I know I talk about this a lot in the context of epidemiology and what does it mean and how do we explain it? And I've talked about that a lot from my own perspective on this podcast. We're going to set aside epidemiology. We'll come back to that in another episode. I want to start with really dissecting public health. And I see that this happens a lot if you think of some of us that are in academia or senior level, more executive level positions, more front facing, those that are in front of media or in front of people where they're often speaking to colleagues, peers, other leaders. There's sort of one set or one style of conversation in terms of how we talk about it and how we explain it. If we're involved in any aspect of a scientific community, that's sort of one language that I'm not really talking about on this episode. What do we say to the non-scientific community, the people who want to hear about this in layman's terms, plain language? How do we talk about that? And it's not easy if you think about, we all wear so many different hats in all the different areas and specialties of public health. So I was thinking about this. I'd actually been researching this a bit, and I wanted to bring this episode. I wanted to talk about it. In the process of doing all of this, something popped up in my news feed that was so aligned, and I just wanted to share that with you. It's actually a new podcast, and if you're watching this video, you're going to see me looking back and forth. I've got a lot of notes and things up on my screens as I'm recording this with you. But there's a new podcast called, relatively new, Shared Humanity. It is produced by Yale School of Public Health, and the host is Nelba Marquez Green. So this is episode number 8, and there was a video clip. She's interviewing the dean, Dr. Megan Rainey. So some of these names might be familiar to you as you're listening. I do recommend checking out this podcast and listening to the full episode. I'm a fan of podcasts in general, and I really love it when I see a strong organization like an academic institution or a larger public health agency that creates a podcast and there's a conversation happening, it's an opportunity for us to join in on that and hear something that feels and flows like a conversation as something instead of something so rigid. So I was always excited to see something like that and ready to check it out. I do encourage you to explore the podcast. But what caught my attention was in my feed on LinkedIn. I was kind of scrolling through, and there was a video clip from this particular episode. And I love it so much because for two reasons. First of all, the host, Nelba, of course, she's a public health, she knows what public health means, but she's asking, as a good host would, thinking about the audience. And she just simply says, before we get into this too far, for someone who's listening who may not be familiar with public health, how can you explain it to them in digestible pieces to help them understand? How would you explain what it means? So that's the context of her question. I love that question so much. And then at the same time, Dr. Rainey's reaction was exactly what I feel when someone asks me, when I feel if I'm caught off guard a little bit, or just, when someone asks, what is epidemiology? Or what is public health? I'm racing through my mind to decide, okay, what version am I going to explain? Trying to scan, like, how much, do I assume they understand or not understand, and kind of putting the words together. Now, that's me, and that's what runs through my mind. But Dr. Rainey's expression, she paused. She gave a very great response, but it's that initial reaction to the question that I think hits us a lot, because we understand it. We love talking about it in certain settings, and it feels very natural. It flows. It's not always easy, and for us, or second nature for us to answer that question. How do we break it down in digestible pieces and explain it to someone who's not really familiar with public health? And so that seeing that video clip was right during the time that I'm trying to prepare for this episode. And I thought, yep, this seals it, because it was a little triggering, I guess, for me, because I think about all the times people ask me, what does it mean? What does public health mean? Or really, it's about epidemiology. Usually is when I get that question. I'm trying to figure out what to say. But her reaction, just kind of collecting the thoughts and thinking about what to say and then beginning to speak. She did a great job. And nothing negative whatsoever to say about how she responded. It's just, her reaction reminded me of how important it is for all of us to really, I'm just going to say, practice. How do we explain this? So I'm not talking about when we're in the context of where we've had time to prepare and maybe we're speaking among our colleagues or some level of scientific professionals and we're articulating a response. I'm not really talking about that. I'm talking about everything else. And so what I've done is I started to break this down, and I wanted to search around and see, like, how are we explaining this? Who's got great examples? What do I see when I start to search around? As if I'm someone to search and see what is public health. I'm trying to figure out what it is. Well, I go to some of the schools of public health and websites, and I just started to pull a few things to see what was there. So I'm going to share a few examples of what I found. What I'm building up to is sharing with you some I'm going to share a little conversation starters in just a few minutes. And what I'm saying, I'm calling them conversation starters because there are ways that you can explain public health in very simple, easy to understand, I think, language. And I think it starts a conversation. So you may answer that question for that person, and then maybe that opens the door for the conversation. But before we get to that, I'm going to kind of explain a little bit more of taking you through the process and my backstory here. So when I was thinking, what is public health? And I started to go to some of the schools of public health, I didn't do any special systematic process of determining which schools I was going to find. I just started poking around like we do when we're trying to figure something out. We start doing searches and looking for it. So here is something that I found from the University of Texas, the Health Sciences Center at Houston. So UT Health, School of Public Health, let's see. Yep, UT Health. This is Houston. So I am going to read it because I think it starts out kind of structured, but then it really quickly moves into something that's gives some examples and puts into context that I think is easy to understand. So it starts out with, everything we do as public health professionals aims to use research and insights to encourage healthy practices, prevent disease and injury, and improve quality of life, all on a population scale. So that's not something I would actually say if it was just, if my aunt or my cousin or my friend asked me, right? I still think that's a little bit more of a professional setting, a little bit more structured. But then what comes after that? One of the public health's defining characteristics is that we are constantly trying to get ahead of the problem, approaching issues from a proactive instead of a reactive stance. We call this going upstream. Rather than treating a person after they've become ill or hurt, we try to prevent sickness and injury in the first place. I like that because, I mean, we use that phrase, going upstream a lot, but I really like the way that they explain that. And I think that that's something that can be pulled into conversations and, can really help people to kind of start to frame and understand, oh, okay, that makes sense to me, moving it along. So they go on with another example here. They say things like worker safety regulations, vaccination campaigns, promoting good hygiene in school, and having open, honest conversations with people about the risks of unprotected sex are all examples of public health efforts that have saved lives and prevented the spread of disease. I really like that. I feel like that is a really good explanation of public health that expresses how broad it is with some examples that really will get people to think, okay, well, I'm starting to get it and it's starting to come together. So I really like that one. Here's another one that I found from Johns Hopkins Bloomberg School of Public Health. So on their website, all of this is straight there. Well, I'll share some links because I want you to have all of this. I'll share some links in the show notes. So no worries if you're listening and trying to figure out where did she get this? Okay, so from Johns Hopkins, in the medical field, clinicians treat diseases and injuries one patient at a time. In public health, researchers, practitioners, and educators prevent disease and injury at the community and population level. We identify the causes of disease and disability, and we implement large-scale solutions. And then, for example, and it goes on into instead of treating a gunshot wound, we work to identify the causes of gun violence and develop interventions to prevent it. And then it goes on with a couple more examples that fall under, birth weight and keeping babies healthy, high blood pressure and examining their risks. And so it gives a lot of examples that can help people start to wrap their brain around, getting a sense of what public health means. I like that a lot. So then that led me to, you hear me often talk about the American Public Health Association on this podcast. So I wanted to know, I've gone there before, but I wanted to know what do they say about public health? So on the website for APHA, public health promotes and protects the health of all people and their communities. The science-based, evidence-backed field strives to give everyone a safe place to live, learn, work, and play. If you've ever been to an APHA conference, you've heard that a million times. Sometimes we say it so often that we just kind of blurt it out without really thinking about how it could help us explain this to other people, what public health means. Because we're in that context, we're all public health professionals. So we're just having a conversation usually amongst our peers. So they do go on to have a lot of other examples on their website as well. It says every day the public health field is working, often behind the scenes, to prevent hazards and keep people healthy. For example, public health is responsible for, and it has a whole list of things that are very much like what I described in some of the other examples that kind of give all the examples of gun violence and nutrition programs and vaccinations and climate change and racism, or declaring racism as a public health crisis. So all of these things are part of the examples that are on the APHA website to help explain what public health means. Then I got to thinking, let me roll it all back, and I wanted to go to defining health. So I went to the World Health Organization's website. So the WHO defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. So for some reason that really started to ring as a strong reminder. So as I started to pack these conversation pieces together, I thought, when someone is not really familiar with public health and we're explaining what public health means, I think it would be really good for us to incorporate what health means so that people are understanding that, this kind of two components of health is more holistic. It's physical, mental, and our social well-being. And it's also not just the, absence of disease. So keeping that in mind, I know I'm kind of thinking, where are you going with all this? I think these are just some of the things, and if you think of buckets here, I think it's great to scan what other websites are, what they have and what they have to say about public health. Other websites meaning our academic institutions, maybe your alma mater, maybe your current student, maybe you work there. But what do they have to say? Or maybe some other academic or institution that you look up to or that you admire, that you follow? What are those leading schools of public health have to say on their websites? And pull that information and then disseminate that out into the community. Use that. Put your own twist on it. You can do all of these things. I'm not saying that you need me to help you explain public health to other people. What I am saying is that as public health professionals, everyone listening to this podcast, what we have the ability to do, and it's in our power and our, part of our strength as individuals, is to translate that, explain this to others, bring value to our industry by helping other people truly understand what public health means and what it is so that they can start to value public health. We bring that value by taking the effort to explain it, and then we can start to value our industry and other people start valuing our industry as well, which I think is goes a long way, especially in just in the coming on the heels of this crisis coming through the COVID pandemic, the height of the pandemic. And we know COVID is still here, but a lot of our, flaws were highlighted as well as a lot of things that we did well. But we know now more than ever how important it is that people truly understand what public health is and we need to value it more. My goal is to share some conversation starters with you. These are some simple ways to explain public health when you're being asked by people who really just want to understand. And maybe they're really not wanting a technical answer. They don't want something that's really scientific or really using a lot of scientific jargon. And that's what I've brainstormed out, put together. And I really had my team go, we went as far as, I want to get this into your hands. This is not the end all. This is just to get you started. Maybe you'll take this list of what I'm going to share with you and you'll share it with students if you're a professor. Maybe you'll share it with other colleagues and that could use it in a variety of ways. And maybe you'll take it and add to it, put your own spin on it. I would love for this to become a growing list. And it's not for you to, but you may take this and just take a few things and incorporate it in what you do or put your own spin on it and run with it. But it's something to help us practice. And I'm going to go through some of these and I've got several of them highlighted as my favorite, because when I read them, created them, tweaked them, read them out, it made me think of certain people that I would love to really just go back and share that with them. It reminded me of a lot of times when I was asked to explain, and I don't think I did such a great job. I left them more confused than clear. So this is helping me, and I hope it helps you as well. So I have several that I'm going to read to you, and we're going to talk through. And then a show notes page, I'll tell you at the end, but basically the show notes page, you'll be able to see all of these or download a copy that you can have to use however you decide to use it. Okay, so the first few that I'm going to share with you, I think are actually really good if you are having conversations with kids, maybe not little kids, but school age kids, maybe middle school, high school kids that are trying to understand it. These are, at this age where impressionable age where maybe they're even thinking about what they want to do and trying to decide on a career. On this podcast, how many people have you heard me interview who said they started out medical school because they knew they were interested in health, but they thought it was just, that was the way to go. So they started out pre-med and then they discovered public health and made a pivot. Maybe we can start to explain this to younger kids, school age kids, as they're trying to decide what they want to do. And they can start exploring this as an option for a major when they go to undergrad. So okay, so here are just some examples. And there's, like I said, these first three are for kids. Well, not just for kids, but I think I put it into context that way. All right, so here's number one. Public health is about creating environments where it's easier to be healthy, like making sure your school has decent lunches, working water fountains, and clean bathrooms, or making sure that there's safe places to walk, bike, or hang out with your friends. Tweak it however you like, but I think that could be really, I'm thinking about some of the times I've had conversations with younger kids in my neighborhood, especially when my kids were when, their friends were over and sometimes the conversations would come up. Here's another one. It's like if someone's asking, again, this is like how you're explaining what public health is. It's like being a health teacher for the whole city. Public health workers help everyone learn about staying healthy, from teaching kids about washing their hands to showing grown-ups how to eat better and exercise more. All right. So here's the third one in this category for you. Again, answering for, kids. Public health is like having health coaches for entire neighborhoods. They help communities get things they need to stay healthy, like making sure that they have safe parks for kids to play in and places to buy fresh fruits and vegetables. All right. So, those I thought were just kind of kid friendly. And, again, we're talking kind of school age, middle school, high school kids. But, it doesn't have to be limited to kids. So I'm going to read a few more. I actually have a lot. And for the sake of time, I won't read all of them on this episode. I want to read a few of them. And then I'll let you know how you can, like I said, show notes is where you can download a good list of them. Okay, let's see how I can do with time. A few more examples, how you can explain public health to people who, and it will, regardless of where they are, but just explaining public health, it's not too technical and more relatable. And that I think can be really great conversation starters. You may explain it and they're like, oh, okay, good. And it settles there and the conversation may pick up later, or that might be all they need, or it might really open up the door for a much deeper conversation. All right. So here's one. Public health is about fixing health problems at their source. Instead of just treating someone's asthma, public health workers tackle air pollution that's causing breathing problems for everyone in their neighborhood. They're dealing with the root cause, not just the symptoms. All right, here's another example. It's like being part of a health protection team that works behind the scenes. While you might not notice them day to day, public health workers are making sure the water you drink is safe, the air you breathe is clean, and disease outbreaks don't spread through your community. All right. Here's another one. Now, I have stars next to these because I especially like these. All right. So the next one is public health is like having weather forecasters, but for diseases instead of storms. They try to predict when illnesses might spread, they try to predict when illnesses might spread and warn people about how to stay safe, just like meteorologists warns us about bad weather. I used to really like meteorology, so I like that one. Okay, so here's another one that I like. Think of it this way. If a doctor is like a mechanic who fixes a car that's been in an accident, one car at a time, public health workers are like people who make sure all the roads are safe, the traffic lights work, and everyone knows the rules to prevent accidents in the first place. What do you think of that one? I thought that was pretty clever. All right, so I like that. Here is one. I think this one could be nice if you're talking to someone who's a little older, maybe an older uncle or aunt or parent. And this may not relate to those of you who are outside of the United States, but we have a system here. Anyway, let me just read it to you, and then we'll see how it lands. So you could say to them, remember when restaurants started putting those letter grades in their windows? That's public health in action. They're the ones checking to make sure your takeout won't make you sick. Now, I realize that could also spark a conversation about the last time someone got food poisoning and yada, yada, yada. But it's still a way for you to explain public health in that context. And it's an example that some people can really relate to. Okay, here's another one. Meaning public health workers, are like the behind the scenes crew that makes sure your tap water is safe to drink. You don't have to think that much about it, but someone's making sure you don't get sick every time you fill your coffee pot. Now, when I read that, when I think about my father-in-law, and I actually might just bring this up in a conversation because he is very old school. He loves like a fanatic about his coffee. And a lot of you may be listening thinking, I don't drink tap water, but a lot of people do drink tap water. And we've had a conversation about tap water before. And he doesn't like the filtering system that's in my refrigerator. Like, why can't you just drink tap water? There's perfectly good water. So now I think I want to go back and have this. I want to read this to him. I want to say this to him. So anyway, I like that one a lot. All right. So let me just read a couple more and then I'll wrap up. And like I said, you can read the rest of these on your own. Okay. Think about your workplace safety rules, like wearing protective gear or having fire exits. Public health people help create those rules so that you don't get hurt on the job. I think this is great. A great one is I think of especially folks that are maybe factory or laboratory type work where you have to wear, you have rules about what shoe you can't wear open toed shoes and you have to wear safety goggles. Like people that have those requirements. This is a great example, a great way to talk to them about public health. All right, here's another one. They're the ones, meaning public health workers, who figured out that cigarettes were killing people and fought to get warnings on packages. They look for things that are making lots of people sick and try to stop it. Be careful not to get into an argument with someone who's still smoking about, that could go down a whole different rabbit trail. So you just pick and choose which ones of these you'd like to use. Every time I wrote one of these, I thought of like someone in my family or someone that I know that would have an objection to what I'm saying, how it could easily be twisted into some sort of argument. Don't go down that road with anybody. These are really those moments when someone's genuinely trying to understand what public health is or what you do, and maybe you're just trying to respond to them in a way to help them understand. All right, let me give you one more. Public health folks are working in the background to catch health problems before they mess up your life. They're not the doctors you see when you're already sick. They're the ones trying to keep you from needing to go to the doctor's office in the first place. I like that one too. So you get the hint, you get the gist here. I am giving you some examples of conversation starters to help you get going. I would encourage you to get a copy of this from the show notes page and practice this if you're students, practice with your your fellow classmates. If you're in any position, if you're a professor, if you're a mentor, if you're involved with a group of students, you can turn this into an activity. You can do a little role playing. And then challenge someone that to extend this to not just role play among your peers in the classroom, but really get into a real situation in a setting where you test this out with people, your siblings, your relatives, your parents, your aunts and uncles, cousins, people that are going to be very forgiving if you stumble around on this, but test it out. The more we kind of use air quotes here, practice this in a space like this with some friends and family that are close to us, the easier it becomes to put it into action outside of that trusted circle. But if we don't ever really practice having these conversations in this setting, I think we'll always kind of back away from it, or we'll just regurgitate that one out of the textbook, which is accurate, but it doesn't always land well when people are genuinely just trying to understand what public health is, what we do, what does this mean? They're trying to wrap their head around it. And I think that this is where the power comes. We add value, we become more confident, we value it. We're proud of what we do, and we want them to understand what we do and how we serve and how we show up. So hopefully this is going to help you and help others understand what is public health, right? We want to be very conversational about that. You won't knock it out the park every single time you do this, but just keep doing it. And it will feel a little bit better each time. And you just laugh to yourself when you botch it and you walk away. It's like, okay, well, at least I tried. But you can always follow up and come back a little bit later and try again and have the conversation again and continue on from there. I had a lot of fun putting this together. I had a very long list, pages of examples, and I had to go through and cut out the ones that did not kind of light me up. And it's a little quirky. We're all a little kind of awkward and nerdy, but that's we embrace that, right? So some of these are like, I would never say that. You were reading, I would never use that. That's okay. Tweak it and make it your own. But the point is that we really need to. I'm encouraging you to take some action on this. Have fun with this, but this is something that is all within, all of our wheelhouses, right? All right, one more thing before we go. Please take a moment and share this episode with a friend. I know that you know at least one person who would really like to hear this episode and get their hands on this document that I'm talking about. Send this episode to them directly by sharing. If you're listening on one of the podcast apps, you can share that to them in a text message. You can share it directly to social media. If you're on the show notes page for this episode, when you go to grab the document, you can also use the social sharing buttons at the bottom of the show notes page. It makes it really easy to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day.